Look, see, and observe the surroundings. How was the youth or teenagers today? It's terrible. Every year, an estimated 21 million girls aged 15 to 19 years old in developing regions become pregnant, and approximately 12 million of them give birth. At least 7,700 births occur to adolescent girls younger 15 years old in developing countries, such as in the Philippines. Teens are vulnerable, especially when there is an older man, or should we say their partners, who are willing to promise a long-term committed relationships. Money, big houses, nice cars, an exchange of sex. However, these girls are often blindsided and left alone with empty promises. This campaign urged teens to think deeper about the effects of pregnancy at a young age. More importantly, that teenage pregnancy is not something to glamorize. Engaging teens to look closer at everything that comes along with having a child. And yes, all we know that child or babies are blessings, but have you ever think at all? What was your responsibilities? What was the consequences before and after your actions? If you are not yet ready, if you are not old enough, you are not matured enough to carry and care for babies, how would it be? And what are the main problems of teenage pregnancy? Or should we say, what are the negative effects of teenage pregnancy as a whole? At this period of time, teens' pregnancies were seen as obstetric problems, which we are associated with an increased risk of anemia, preterm labor, urinary tract infections, hypertensions, preeclampsia, and high rate of cesarean sections, but also preterm birth, low birth weight, and intrauterine growth restrictions. And now, what is the main causes of it? The teenage pregnancy. First, the poverty. Some do sex because of poverty. See? Gender inequalities, gender based violence, the substance use. The substance use is one of the major reasons why there is a early pregnancy occur. Because nowadays, in this generation, teenagers also involved to this issue or to this case. Next is the poor access of contraceptive, the inconsistent and incorrect usage of contraceptives, and the limited numbers of healthcare, the guidance of the parents, and also their wills to enter this kind of situation. Almost 7,000 or 1,700 teenager girls get pregnant every single day. That's 70 girls every hours. Truly, 82% of teenage pregnancy aren't planned. Have you ever think of what? Teenage pregnancy is not an inner city issue. It affects the entire community. If you are in your pregnancy period, how it will be happened or how it will be affect your life. adolescent pregnancy remains a major contributor to maternal and child mortality. Complications relating to pregnancy and childbirth are the leading cause of death for girls aged 15 to 19 years old globally. Pregnant girls and adolescents also face their health risk and complications due to their immature or baby bodies. And now, almost people, almost globally or internationally, know and familiar, even even around the world, is familiar to this case. So, by prevention of spreading the early pregnancy for youths or teenagers, we must engage teen pregnancy prevention program to conclude comprehensive sex education, HIV or age prevention, youth development, service learning, and abstinence approaches. Let's be one team, one unity to have actions. Be a good role model to each and everyone and to decrease and to help us to decrease and stop the early pregnancy, the number of early teenage pregnancy. And to all girls out there, always remember God says, we girls are precious than rubies.